universities today, students are still learning through traditional lecturer-based teaching methods. Although lecturers are deliver information quickly, students often become passive learners who only listen, memorize, and prepare for exam. Because of this, universities are now focusing more on active learning strategies. Today, our group will be discussing about the topic implementing activity strategies in universities' classroom. Active learning is a teaching approach that encourages students to participate actively in the learning process instead of only receiving information from lecturers. Students become more involved through activities such as discussion, collaboration, problem solving, and sharing ideas. Next, let's watch a video where some lecturer from University of Minnesota shares their views on active learning.
I'm not sure that for everybody, active learning is the one and only way. I will say that for me, I have found significant increases in engagement when students are actively working towards something because they're in progress around discovering ideas with you, and not just with you, but with each other.
Prior to implementing active learning, there were people sleeping, and I don't see people sleeping in my class anymore.
I find that even students who are quiet in the rest of class, who don't contribute to discussion very much, during these simulations, almost without exception, they step forward and really jump into their roles. It's really fun.
It kind of creates this sense of belonging in the classroom, and that leads to motivation, and that's what leads to better learning outcomes.
So now that we know that active learning actually works, we have an obligation to understand that and apply it and discard traditional techniques that are now shown to be less effective.
One effective active learning strategy is concept mapping, which is the method chosen. A concept map is a visual learning tool that helps students organize and connect information using keywords, branches, and relationships between ideas. Concept maps are effective because they help students understand the relationship between concepts instead of memorizing facts separately. This allows students to think more critically, organize information more clearly, and improve their understanding of a topic.
According to National Library of Medicine, among the advantages of using concept maps is the potential for students to learn material more deeply. Through concept mapping, students need to analyze, compare, and connect different ideas together, such as patient condition, treatment approaches, and occupational performance problems. Instead of memorizing information only, occupational therapy students can understand the relationship between concepts better. Other than that, concept maps help students combine and organize different pieces of information into a clear overall understanding. Instead of learning topics separately, students can connect patient condition, treatment goals, intervention, and clinical approaches in one visual framework. For occupational therapy students, this can improve clinical reasoning skills because they are able to see the bigger picture of patient management and understand how different treatment strategies relate to each other. In addition, concept maps encourage students to think critically and solve problems more effectively. When creating a concept map, students must identify important information, determine priorities, and connect concepts using lines or arrows to show the relationship between the ideas. This process helps occupational therapy students develop stronger analytical and decision-making skills. For example, students need to connect patient symptom, occupational limitation, environmental factor, and suitable intervention in a logical way. As a result, they become more confident in clinical reasoning and planning intervention.
In Malaysia, many of the students enter university from an exam-oriented background where memorizing is the norm. The first challenge is the shift in mindset. Concept mapping requires active analysis and synthesis of information, which can feel overwhelming for students who are used to simply memorizing facts for an exam. The second challenge is cognitive overload. OT is a holistic profession. When students try to map out a single patient case, linking physical impairments to psychological factors and environmental barriers, the maps become incredibly complex. This high mental effort can lead to frustration and a lack of motivation to use the tool effectively. Language and cultural context also pose a hurdle. Most autism work are Western-centric. Malaysian students often struggle to translate abstract English terminology into a visual map that reflects local cultural realities, such as specific activity of daily living like solat or traditional eating habits, making the mapping process feel disconnected from their practice. For lecturers, the challenges are logistical. With large class size and a packed syllabus, providing individual feedback on concept maps is time-consuming. Furthermore, grading this map is difficult because OT listening is subjective. Creating a standardized rubric that is fair and consistent across all students is a significant academic challenge. In summary, while concept mapping is a vital tool for developing clinical reasoning, Malaysian OT programs face barriers in student habits, cognitive load, and institutional constraints. Addressing these challenges is the first step toward creating more reflective and capable future therapists. Thank you.
Building on what we discussed, I want to share our proposed practical active learning activity for occupational therapy courses. As you can see for the demonstration behind me, we are implementing concept mapping for the OT process using a stroke client's case study. This activity is specially designed to enhance student engagement and understanding in Malaysian university OT classrooms. Let me clarify how this activity works. First, group start with the core case, stroke clients, OT process at the center. Then add key OT components, assessment, goal setting, intervention, evaluations, and discharge planning. Students connect all concepts using linking words, such as lead to, guides, begin with, and so on. This method helps students understand the full OT process logically, instead of memorizing steps in isolation. This concept mapping activity provides clear benefits for OT students. First, it strengthens clinical reasoning by showing how all clients' information connects. Second, it bridges the gap between theory and real-world practice. Third, it improves teamwork and active participation. This activity is practical, low cost, and highly feasible to implement in Malaysian university classroom.
In occupational therapy education, concept mapping is an important teaching and learning strategy because OT students need to connect multiple concepts in clinical practice.
Concept mapping helps students organize complex information such as symptoms, functional problems, and intervention strategy in a clear and structured visual format, making it easier to understand how much element is connected and how they related to clinical decision making.
To better understand how concept mapping is used in practice, let's look at a simple clinical sample. For a patient with strokes, they may experience right side weakness, which can lead to difficulty in daily activity such as feeding or dressing. By using a concept map, students can clearly link the medical condition to physical impairments, and then connect this impairment to the patient occupation performance problems. This step-by-step visual thinking helps students organize information more systematically and support more accurate clinical reasoning during treatment planning.
It improves critical thinking by encouraging students to analyze information instead of just memorizing it, strengthening clinical reasoning by helping them link patient problem with appropriate intervention, and help students clearly understand the relationship between different concepts in a structured and meaningful way.
Nice.
In conclusion, concept mapping is an effective teaching and learning strategy in occupational therapy education that helps students to connect theoretical knowledge with real clinical practice. Besides, it also helps to development of essential clinical skills such as problem solving, critical thinking, and clinical reasoning. Thank you.